What is the difference between regular colic and impaction colic? Is one more bad than the other? This is interesting. I don't know what regular colic is.
I don't either. I'm just going to go with this. Although this is also a question I really like because it's a little bit related to poop.
It's true. That is very true.
So let's start at the beginning just so that everybody's on the same page, and colic is abdominal pain. The AAEP, or the American Association of Equine Practitioners, recognizes three kinds of colic, three categories, I should say, or classifications. One is the intestinal dysfunction, and that's where the impaction fits in. Also included here would be gas colics, the spasmodics, the ileus, which is just not, where the intestine's not moving for whatever reason. The next category is intestinal accidents. These are the bad ones. These are the ones that go to surgery. These are the torsions and displacements and twists and entrapments, strangulations, obstructions, things that you just hear and you go, ooh, those need somebody to go in and fix them. And then the third category is your general, your other, and it's things like just inflammation, infection, parasites, sand and stress, medication sometimes can lead to colic. So I don't know where regular colic fits in one of those.
When I read it, my thought was like, okay, regular colic is probably just like, oh, he's a little colicky, give him some Banamine, oh, now he's fine.
So maybe mild would be how I would, and probably gas colic.
Most commonly,
I would think.
Walk them around, put them on a lunge line, and then celebrate when they poop.
Yeah.
It's that one.
and so her question was, how are they different?
How is regular colic and impaction colic different? Is one worse?
Well, so the mild colics that are resolved on the farm with a little bit of help, maybe your vet didn't even have to come out, would be classified as medical. And then the ones that don't get better with even the veterinarian support, like the pain, we can't control the pain. Maybe they're going into shock, they're having cardiovascular issues, or one of the tests your vet does on the farm for colic is like a rectal. They find that obstruction, they find that entrapment, and they know, uh-oh, this horse has to go to surgery. So one answer to your question is regular colics or mild colics tend to be medical and conservatively managed, and then other colics can turn into surgical colics and have to be operated on. The other is the risk factors. We know there are some things that lead to colic or increase your horse's chances for developing colic. There's some specific ones like coastal Bermuda hay, which is a hay that is common in the southeast parts of the U.S. That can lead to a very specific kind of impaction colic in the section of the small intestine called the ileum. So if your horse had an ileal impaction and you were feeding coastal Bermuda hay, your veterinarian is probably going to say, let's try feeding something else. Same with any kind of coarse, poor quality hay. Some people feed even straw because they want to give their horses chew time and gut fill, but they can't have the calories. And boy, that can lead to a case of impaction, as can dehydration or not drinking enough water.
Can you explain what exactly impaction is?
Yeah, we did some training yesterday upstairs, and I showed pictures, and we had a little video of the intestinal tract, the colon. Between the one section of colon and another, it's like this big around, and then it goes down to this small. Well, guess where impaction colics happen? So it's when bulky, coarse food that doesn't have enough water in it, it's not moist enough, lodges and kind of blocks and doesn't move forward. And then it's an impaction, and it stretches internal receptors, and it's uncomfortable to the horse, and it begins to show pain. Now, some of those can be resolved medically when the vet passes a stomach tube and push down, say, mineral oil or even just more water, and they get softened and then they naturally pass. But sometimes if they're too hard or been there too long, or they're beginning to deteriorate the
health of the
intestine, devitalize it, cause a lack of blood flow, then it's time for surgery.
So it's entirely possible that a mild impaction could look like a regular colic. if you give Banamine and then everything relaxes and it passes through and then the horse is fine.
Correct.
But a more severe impaction could be all the way up to surgical and life-threatening. So.
And I always recommend people call your vet every time you see a horse acting uncomfortable. Don't wait, because time is of the essence as far as survival.
All right. And for anybody else who is worried about colic, I would encourage you guys to go onto our website at smartpak.com/colic risk quiz. We have a quiz where you can get a custom assessment of your horse's own colic risk based on factors like what type of hay you feed, how well hydrated your horse usually is, and a whole list of other proven colic risk factors.
Right.
And then, of course, if you want a little extra peace of mind, I always want to make sure people know about Colic Care, which is a free colic surgery reimbursement program that's paired with a digestive health supplement and a veterinary wellness program, a vet-directed wellness program. You guys can learn about that one at smartpak.com/colicare.